welcome to the August 15th meeting of the Rotary Club of Louisville. I'm Lori Flannery, Club President, and Paul Harris Fellow. This is a reminder, if you all will please make sure your devices are off so we don't have any unexpected bells and whistles going off. I appreciate it. Providing today's invocation is Dr. Rick Smith. He's the Senior Vice President of Institutional Advancement at Simmons College of Kentucky, Club Director, Chair of the Diversity, Equity, and Inclusion Committee, and Vice Chair of the Youth and Education Committee. Rick?
Thank you. Good afternoon, friends and fellow Rotarians. As we gather for this week's Rotary Luncheon, let us take a moment to reflect on the shared purpose that unites us all, regardless of our faiths, our beliefs, and our backgrounds. We come together today with a spirit of gratitude, mindful of the opportunities we have to live out the Rotary motto, service above self. We're thankful for the diverse talents and perspectives that each of us brings to the table, and for the opportunity to learn from one another. Today we extend a warm welcome to Tiffany Benjamin. There's Tiffany. Got to saw a leader who I admire personally, whose work in advancing health equity and fostering well-being serves as a powerful reminder of the impact we can have when we dedicate ourselves to the service of others. As we listen to her insights, may we be inspired to continue our own journeys of service, striving to create a more just and healthy world for all. Let us open our hearts and minds to the message we'll hear, and let it guide us in our actions as we move forward. May our discussions today be fruitful, our connections strengthened, and our commitment to service above self renewed. Thank you for the privilege of gathering in this way and for the shared purpose that brings us together. May we all leave here with a sense of renewed purpose and a deeper commitment to the common good. Thank you.
Thank you, Rick. Now for the pledge and the four-way test, we have Stuart Bridgman, President and CEO of Bridgehaven.
Please join me in the Pledge of Allegiance.
With allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Please join me in the four-way test.
Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned?
Thank you.
Thank you, Stuart. So now we're going to introduce our guests that are with us today. So Rotarians, if you have a guest with you, if you'll please make your way and line up where this microphone is, to my right or left. And so Rotarians, if you will please state your name for the club to hear, and then introduce your guest, giving their name, organization, and affiliation as appropriate. And guests, when you hear your name, if you'll please stand for just a moment so that we can all put a name with a face. Thank you.
Hello, fellow Rotarians. I'm Henry Heiser. Lori, and I'm happy to introduce my guest today is Mira Catherine Corlett. She is a candidate for Metro Council District 18. Welcome, Mira.
Always a little mic adjust. Hello, fellow Rotarians. My name is Bridget Johnson. My lovely guests today are Rush Trow, who is our Director of Resident Services at New Directions, as well as his assistant, Nina Jones.
Welcome.
Hello, I'm Ann Monell, and I'm Executive Director of the Legacy Foundation of Kentuckiana, and I'm pleased to introduce my guest today, Emily Rose, who is the Vice President of Advancement at Louisville Presbyterian Theological Seminary.
Welcome. Okay, guests, and so after you hear, oh, I'm sorry. She snuck in on
I'm
me.
not sure this guest is here. Walt was not able to be here today. Is Dr. Steele from Walnut Baptist Church here? No? Okay. Maybe next time.
Thank you, Jelaine. Sorry, I was jumping ahead. So guests, when you hear me ring the bell at the conclusion of our program today, that will mean that we're adjourned. If you will just spend a few minutes before you leave at this table over here in the corner, It's a What is Rotary table, and one of our most important Rotarians, all Rotarians are important, but one who steps up all the time, Craig Sherman, the gentleman standing over there in that corner, will be at that table just to spend a few minutes letting you know all about Rotary. So thank you for doing that. Okay, as usual, we have several Rotarians that have been recently in the spotlight. So I'm going to point out a couple of those today. The community was out in full force in support of Rotarian Devon Holt at a welcome reception at the Muhammad Ali Center. I know a lot of you all were there, and I know he was very gratified to see you all. He is the new CEO of the Muhammad Ali Center, so that happened this week. Congratulations to Rotarian Erica Fields. She's a finalist for the inaugural Bourbon Women 2024 Women of Whiskey Legacy Achievement Award. I know that's hard work. The award ceremony will take place during the Bourbon Women Symposium on August 16th. So I love that name, Symposium. Also, Erica was recognized at the National Gay and Lesbian Chamber of Commerce 2024 International Business and Leadership Conference with a Transgender and Gender Expansive Visibility Award. So congratulations to Erica on both of those. We also want to congratulate these member organizations that were recognized as one of the 2024 best places to work in our region by Business First. So first we have Gilda's Club, Kentuckiana. We should clap at these. It's hard to be the best places to work. There's a lot of balance that goes into that. We also recognize Glenview Trust Company, Greater Louisville, Inc., Independence Bank, Louisville Public Media, and Miranda Construction. So congratulations to all of you all. Our club was also in the spotlight as well at the Lincoln, Nebraska Rotary Club recently, where they featured our West Louisville Housing Initiative as an example of something that Rotarians are doing around the country that is innovative. So yay us on that. We knew we were going to start getting national recognition for that at some point. Okay, we also have some upcoming events that I want to make sure you guys are aware of. Our next Rotary Business Synergy event will be Tuesday, so that's next Tuesday, August 20th, at the Kentucky Humane Society on Linden Lane. This is a free networking event, and it's going to include bites, beverages, and furry friends. So please consider coming and bringing a guest. The time will be 5:30 to 7:30 in the evening. We also have the Social Activities Committee that is inviting you to a Rotary Happy Hour on Friday, September 6th on the patio of Colonial Gardens. And you may know that's across the street from Iroquois Amphitheater. The popular band called the Checkmates will be playing from 6 to 9. And if you are interested in attending this social event, you need to contact Social Committee Chair Jeff Underhill for more information. The Social Activities Committee also has planned a Rotary Day at the volleyball court on Sunday, September 22nd at 12:30 p.m. So if you come down to that, you'll see the U of L women's team take on the Nebraska Huskers. And the registration for that is at a link in Sparks. We are still accepting gift cards and donations for our Kentucky Refugee Ministries family of 8 that just recently joined us in our local community probably about 3 weeks ago. So they're still getting settled, and if you're interested in being a part of welcoming them, please see Mary Ellen Herned for details. We're starting our mentoring up again for our Rotary Honor Scholars. Western High School starts on September 17th, and Iroquois High School on September 25th. You'll need to see Club Treasurer Craig Mooney if you would like to be a part of this important monthly program. And finally, if you are interested in learning more about the Peace on Earth by 2023 Global Peace Movement and Rotary Peace Game, there is a virtual information meeting next Tuesday, the 20th at 8 p.m. And you will need to see Deline for details on that. Now I'd like to invite to the podium President-elect Ken Salvaggi, General Manager of ESPN Louisville, Club Director, and Paul Harris Fellow to recognize a new Paul Harris Fellow achievement.
President Lori, Paul Harris Fellow recognition is given in appreciation to any Rotarian who contributes a total of $1,000 or more to the annual fund or Polio Plus fund of the Rotary Foundation. Those members here today who are part of Paul Harris Fellows, please stand. Wow, good group. As a Paul Harris Fellow, you are promoting peace, fighting disease, providing clean water, saving mothers and children, supporting education, and growing local economies. You are also providing funds for matching district grants that support projects in our community and other communities. And congratulations to Chris Manzo, Principal of Sandbox Design Collaborative, on achieving Paul Harris Fellow +1.
Thank you, Ken and Chris. And thank all of you for investing in the club as a Paul Harris Fellow. It means a lot. I would now like to invite to the podium Ashley Brower, founder and CEO of Max Strategic Communications, chair of the Speakers Committee, and Paul Harris Fellow. She's going to be introducing today's speaker.
Thank you, President Lori. Tiffany Benjamin serves as the Humana Foundation's Chief Executive Officer. In her role as CEO, Tiffany guides the foundation in establishing new ways to co-create healthy communities and eliminate unjust differences in U.S. health and health care. In addition, Tiffany writes extensively about topics around private philanthropy and health equity and teaches undergraduate courses at the Indiana University Lilly School of Philanthropy. Prior to joining Humana, Tiffany served in several roles at Eli Lilly and Company, including as president of the foundation there. She previously served as senior investigative counsel for the U.S. House of Representatives Energy and Commerce Committee. She has a law degree from Harvard Law School and an undergraduate degree in journalism and political science from Indiana University. Tiffany has a lot of recognitions, including one of the 100 most influential Black Americans by The Root, IU College of Arts and Sciences Outstanding Young Alumni, United Way of Center in Indiana's Exceptional Executive of the Year, one of the 2023 Business Women in the Biz Women 100 by Business Journals, one of the Power 50 in Louisville Business First in both 2023 and 2024, and she has received the Louisville Healthcare CEO Council's Optimized Health Equity Champion Award. She's the board chair for the Center for Disaster Philanthropy, chair emeritus for the Indiana University Lilly School of Philanthropy, and she's on the 2024 MBA All-Star Game Committee, which is pretty cool. But the most important thing that you all should know is that Tiffany is one of my classmates in Leadership Kentucky. We're going to repel next week. Right? Gonna happen. So please welcome Tiffany Benjamin.
Can I take this mic off? Is that okay?
Yes.
I move around a lot. So first of all, thank you for having me. I'm excited to be here. I know a bunch of people in this room, so I expect them to ask me openly hostile questions. I look forward to it. So my name is Tiffany Benjamin. You heard my bio, but I am really only the third head of the Humana Foundation. So I took over the foundation almost 3 years ago, right as it had celebrated its 40th anniversary. And I promptly moved my husband, 3 children, and dog down here to Louisville, and they still all like me, which is good, because, you know, those girls are teenagers, and it's awful. So I came for a few reasons. I had previously been at the Eli Lilly and Company Foundation, really focused on issues of STEM education in Indianapolis, and also focused on global health. But my mom is a social worker, and she actually went back to school to be a social worker when I was a kid. She was a telephone operator when that was a thing. You remember? Telephone operators? I'm sure some of you don't. It's fine. You're very young. I get it. And she took me with her when she did her internships. This was pre-HIPAA, so I remember in the late 80s when I was not born because I'm very young. She would serve HIV/AIDS patients when no one else would, and so she'd take me with her, and I really learned the value of empathy and meeting people where they're at, finding grace in all human beings. And because my mom was a social worker, US healthcare is kind of my jam. I was on the Hill. The first thing I got to do when I was on the Hill was actually help pass the Affordable Care Act. And so, yeah, thanks. It was great. I worked hard, and then I probably violated by drinking a lot from the stress, but it was really wonderful. So that's been my focus. So when this role came along, Humana just has a brand of caring about people, right? And US healthcare, so it seemed perfect. When they hired me, they were going through a strategy refresh, which you're humans, and if you worked any place, you know how strategy refreshes work. And they said, we want to focus on health equity. Come in and help us think about how to do that. And so what I did is I spent some time listening, like a lot of listening. I listened to people at Humana, I listened to people outside of Humana, I listened to people in Louisville, I listened to people in a lot of places across the country to figure out where can we as the foundation make the most difference. And then, I think this is probably relevant to this audience, where should I be leaning into our legacy in Louisville, and what should I be doing to make sure I'm living up to the brand that we have built and the commitments we've built. So in that journey, which I should watch time because my children will tell you I talk forever, so feel free to tell me to shut up at some point. We sort of figured out a few things. The first is that you can't do everything everywhere, so you gotta focus, right? So we picked a few geographies where we want to do our work. So the foundation itself does work in Florida, Texas, Louisiana, and then Louisville. I think it's kind of interesting, right? Because I listed 3 states and Louisville. And so we decided we would do the bulk of our work in Louisville. We do work in Kentucky more broadly, but the rules about the work there are that it has to have a Louisville component, right? It's Louisville and somewhere else. We would, unless there was like a disaster or something else, we wouldn't really do work in Bowling Green. You have to have that Louisville attachment. But if you had something that was in Louisville and Bowling Green, go for it. That's actually great. We're supportive of people expanding their projects. And so we picked those geographies and those spaces. And the reason we did it is we tried to think about places where it's not just like our money that can make an impact, but where we saw there are Humana employees who are there, so we can bring the energy of humans. Places where, like, if you show up and you say Humana, people don't go like, what? Like, if I went to Hawaii, they'd be like, that's nice, you know, like, okay, you're a company. But places where they knew who we were and what our values are, so that people would understand we're coming with good intentions, right? And so we picked those as the geographies, and then what you'll find about me is I like numbers. So then I decided, okay, we gotta pick focus areas. Health equity, really, in its purest sense, what it means is focusing on subpopulations. And that can mean a lot of things. It can mean race, gender, but it can mean geography as well, urban, rural. Those are all subpopulations, and it's about acknowledging inequities, right? So for us, I said, that's great, but it's really, really broad. And I could fund everything, so let's narrow it. The first thing we did is we had done a lot of work in food insecurity, and so we decided to do food insecurity and nutrition. And we kind of defined that 3 different ways, which is just straight up food insecurity, which is focused primarily on older adults, seniors, nutrition education, and then a bucket I call being stewards of good health, which is like, if you're a lawyer, I know it when I see it test, but it's really about the intersection between chronic conditions and nutrition. So for example, we funded some work with the University of Louisville Medical School around screening for diabetes for African Americans in West Louisville. So that's an example of something that might fit into that bucket. And then we have that side, but I decided we would do another side, which is we were just coming out of COVID.
And I'll be honest, I moved to Louisville and I could feel like there was just a sense of kind of sadness about it. You know, like we hadn't connected in so long after COVID, and you could see all this data around teenagers and sadness. You could see all this data around older adults and loneliness. And so we decided that we would really lean into mental health as our second space. And so within the mental health space, we really focus on social isolation, loneliness and its impacts, which also can include trauma. So for example, we funded the Home of the Innocents to do some work around a sanctuary model, which is a model of dealing with adverse childhood experiences and helping foster kids through those types of experiences. And then we also have this thing called Equity in Mental Health Services, which primarily has been about substance use prevention. So we've given money to Volunteers of America to focus on their Freedom House model, which is about mothers and their kids, and the kids being with the moms during recovery, right? So we chose those two areas, and then I had to make my bucket smaller because, as you can hear, I really like strategy and numbers and boxes. And so I said our work really is focused on three populations. Those three populations are seniors, older adults. We're Humana, right? And Humana primarily does Medicare, so it's consistent with the business. We picked veterans next because we have a Humana military group, right? And that's consistent with our business. And then it felt weird to me to say, okay, we're gonna start focusing on your health at like 45. Like, it just didn't make a lot of sense. So I said, well, let's add kids as our third bucket. And we made a decision to pick K through 12 kids, frankly, because we wanted to find places where we can impact a large number of kids at the same time, right? Like, so we're trying to think about like where are there systems and places that people will connect. Schools are a logical one. I'm looking at Henry over there. Schools. So that is like what we did and how we focused on it. I did that exercise over a year, and one of the listening things I heard in Louisville, I heard two things. The first was like, you guys aren't what you used to be. I heard a bucket of that. And so I tried to spend a lot of time out in community, like listening to find out like what is it that we used to be, because I wasn't here, I didn't know. And the second thing I heard is you have to know somebody to get money from the Humana Foundation. And that really bothered me. First of all, I don't think you should have to know somebody to do anything in life. But also from an equity standpoint, if we're going to focus on health equity, we have to be equitable and we have to be transparent. And we also have to be kind of open to the fact that we are a growing group of people who have to continue to learn. So last year, we actually launched an open application, which is actually uncommon for philanthropy organizations. As you heard, I study philanthropy. I'm kind of like a weird philanthropy nerd. I just finished teaching a class on grant making, and the students didn't fire me, so that's a win. So we decided we'd do open applications. So we actually have an application. We launched it in 23. We learned a lot of things from the launching. There was an appetite for it, but also we need to be clearer about our strategy. We took feedback. One of our rules is that if you apply, everybody gets a response. And so we followed that process last year, and we awarded some grants, right? So it's an under-exaggeration, but we awarded probably $20 million in grants. Primarily that was mostly in Louisville. We also learned a lot through that exercise, and I'm kind of a continuous learning person, and my view about philanthropy is like, just because I run a foundation doesn't mean I know more than anybody else, so we tried to be really thoughtful about like, how can we do it better? How can we be smarter? So we relaunched our open application process this year. We tried like a college level early application thing. I'd say it didn't work as great as I planned. I'm always willing to acknowledge when things don't work the way I wanted to. But we saw an increase in applications by the hundreds. I would say in 23 we had 500 and some applications that were completed through our full process. In 24 we had 700 and something. We're not a huge team, so I don't know, it's been a little overwhelming, but it really mattered to me to be able to say, we're gonna read everything. We may not be the fastest, we may not be perfect at any of those things, but if you submit something, we want to take it seriously and give you a response. It may not be perfect, but we're trying really hard. I think because one of the things I heard across the board is like, we need to be present and listen, and throughout this process, it gives us the opportunity to be present and listen. So we we are on a journey, so we haven't announced any grants this year. So if you have a grant out, somebody asked me about, we haven't really told anybody, so in the same bucket. The numbers were higher than we thought, and so we're on our way, and hopefully we'll be there soon. I think we've announced a couple of grants or told a few people, but it's an exercise, and we're trying to learn and grow as we go, so I think we'll be even better next year. My team is small but mighty. We have people all across the country, but the bulk of us are here in Louisville. It was really important for me to live here in Louisville because it is our hometown, and it's like part of the fabric of who we are as Humana and Humana Foundation. And I like to really highlight that because I think there's been a thing that I certainly heard when I moved here, which is like, how is Humana Foundation and Humana committed to Louisville? How are you pulling through the legacy? And so I always like to highlight that David Jones Jr. is my board chair, so we've kept the family connection to the foundation because we think it's important for legacy to be embedded in the future. But then on the other hand, we've tried to move to being thoughtful and dynamic and going where the world is going. The other thing I think about our philosophy of how we do this work is, I talked about listening, like I embed it in my team, I'm kind of exhausting about it. We just got our survey results and I tracked them in a room and was like, give me feedback on how I can be better. And they were just like, please stop, we've given you enough feedback. And I'm like, no, more feedback. We're constantly trying to be better. We're very aggressively focused on collaboration. I think that if you are doing a project and you're the only person doing it, it's hard to get it to sustain if you leave. So we try to find organizations that have a mix of funding. We try to collaborate with other funders when we can. We're not perfect, but we're working on it. And we try to listen to where the needs are and where the needs are going. So we take that stuff pretty seriously. We take our jobs pretty seriously. We do laugh a lot, but we get the responsibility of this role. That's what we do as the foundation from a grant-making standpoint, but I think there are a couple other things that we do that people just can't see. The first is that we do a lot with Humana associates to amplify their impact. So we try to motivate them. We've partnered with the Well Fitness Center, which is our fitness center, to have these events across the city where they'll do you work out and we'll give some money to Dare to Care. And that's part of us getting our associates excited about giving themselves. So the giving isn't just the foundation, or the cause isn't just the foundation. We want the many thousands of associates who live here to be excited about Louisville and the nonprofits in this community. So we want to do both of those things. We did this cool thing earlier this year that I was super jazzed about. We called it Match Madness because it was during March. And we had associates give money to nonprofits, and it was a month where we would double your match if you gave money to a nonprofit anywhere. And then we picked 10 people for a raffle, and if you won the raffle, you could designate a nonprofit, and we would give, one person got to designate $50,000 to a nonprofit. It was transformational. It was actually a very moving story about a man who gave money to the Ronald McDonald House in his hometown because his partner's son had been there, and he volunteered there, and it actually saved their operating budget for the year. It was insanely moving. And that's important to me because while it's great that I give and all these things, one of the powerful things I can do is amplify the impact to our associates, employees, and highlight how all of us can make a difference. I like rooms like this because I actually believe it's great. The money's great, don't get me wrong. I'm not trying to change my job. But it's humans who promote change, right? It's people who make the world different, better, and when they get together and they get excited about things and they get ways to amplify and access and power, they can really deeply make a difference in their communities. And so the associate stuff is stuff people don't see outside of Humana, but it is where I spend a lot of time, because if you have lots of people who really get how food insecurity works in Louisville, then you have more than just our money. You have people saying, hey, we really care about this, and I'm committed to this community. So for us, I think I'm on time. Am I on time? Okay, good. So for us, that part matters. We also do a decent amount of disaster work. You heard I'm a board chair for the Center for Disaster Philanthropy, and it's weird to say disaster is my jam, but disaster is my jam. I just really am interested in natural disasters, humanitarian crises. And so we gave money after the tornadoes and the floods here, and we continue to give money. Actually, we define disaster broadly. So last year, after the old national shooting, we actually gave $1 million. We pledged $1 million to address mental health as sort of a crisis in the community. Part of that was about giving money to GLI to really think about, can we create a business incubator to allow for more mental health services in this community, right? And so GLI ran that program and gave money to nonprofits and for-profit companies that were thinking about, like, how do we get more mental health providers? How do we think about getting access to mental health services for people in different ways? And so that's an example of something we've done to really think about, like, what does crisis look like in a community? It can look like a lot of different things. We also do some grants to academic institutions. Like you heard, I like research. I like reading a lot. So we've added this research component because I think the work, sometimes you just need somebody to say, here's a study to justify why it makes sense doing what you're doing. Like, I really believe in the value of research in academia. And then we also have these kind of random upstream grants that are just about making a difference in the world. So we are one of the inaugural partners of an initiative called Face the Fight, which is a national veteran suicide prevention initiative where we are measuring lives saved in terms of veterans who do not die by suicide. And we partner with the USAA Foundation, the Elizabeth Dole Foundation, and a foundation called Resilience to really ignite that. We have up to 175 partners in that initiative. When we started, it was us and USAA, and it's really grown a lot. The VA's on board, and we're really across the country, including here in Kentucky, making a difference in really raising conversation around suicide with veterans and telling people it's okay to get help and acknowledging that military families go through different experiences. They're somewhat transient. People's identities change, right? Like, you are a soldier, and then one day you wake up and you're not, and that was an identity, and how hard that is for people emotionally. So we really are trying to do things that are thoughtful and make a difference and meet people where they're at. That's what I do. I think what my job is to do two things, which is to listen and then try to translate, right? The one last thing I will say about us is that we are unusual in foundations in that we have a chief impact officer who I hired last year. That means that we have an impact framework where we measure the outcomes of our work, meaning, like, we look at each investment and we measure, like, how did this move the needle for people? And then we track ourselves across the portfolio to see, like, are we making an impact? And that's quantitative and it's qualitative, and we have metrics and we have things that we pick, like, for example, the UCLA Social Isolation Index, which we use to measure, does this social isolation program work? So, like, we measure. We're not perfect at it. We only launched it, like, 8 months ago, so don't ask me for the metrics yet, but I can assure you there is somebody working on it. She's probably very stressed right now. But we are trying to measure our impact because we're a corporate philanthropic body, so we have to be the intersection between corporations and philanthropy, which means we gotta talk in both languages. And so that's why I think my job is kind of being a translator too. I try to listen to what people's needs are. I try to listen to what the business needs. I try to listen to what my board needs. I try to listen to what community needs. I try to listen to what nonprofits need and translate that into a space where everybody can collaborate. So that's what I do. I'm happy to take questions, I guess. I'm sort of scared. Someone throw a softball.
Thank you, Tiffany. It's wonderful for you to be here today. We really appreciate you being one of our speakers. We do have time for Q&A, and so if any Rotarian has questions, if you will line up behind me, and you can ask your question. As I always say, please look at the screen. There's a couple of guidelines on there. Make sure we don't ask Tiffany too many questions and from one person, and there's a little bit of a time suggestion as well. So I will ask the first question.
Ready?
I am curious about how Louisville and the community needs of Louisville compares to the 3 states that you also serve. Are there any differences, or are they pretty much the same?
No, they're all totally, so all the geographies are really, really different. And frankly, it's a hard question because Louisville's a city and every place else I said is a state. It's different in a couple of ways. The first is, frankly, our ability to help with needs is different because it's our hometown. Like, nobody thinks we're insane when we say, like, we want to invest in some of these things. But if you look at the populations, they're really different. So, for example, if you are working in South Florida, there's like just a very high rate of immigrants. And so almost all of the needs are driven by immigrants in that community, whereas here we do have a refugee population, but it's not a huge immigrant population, right? I came from a city, Indianapolis, that actually has a similar governmental model to Louisville, but it is not similar to the governmental models in other places. The metro model is actually quite different, and so what it means is like the partners you work with can vary, and how things get done is very different. Those are the differences. I think the similarities, I'm gonna sound cheesy, but I just am a cheesy person, is that like, I haven't met a single person who doesn't care about their neighbors. I haven't met a single person anywhere who doesn't love the place they live and want it to be better. And I think a difference I see in Louisville is how much people view that as sort of a fabric of who you are and your personal brand being invested in community. And that is not true everywhere. So I think it's like actually a special superpower of this community. Think about it in the Rotary Club sense. Like, some Rotary Clubs are tiny, you guys are massive, right? Like, it's because people feel this personal obligation to be a part of the community.
Yes, we're the 13th largest Rotary in the world, which I take every opportunity to say.
Exactly, and I mean, I think it means something about this community and how people feel about their obligations to other people, and that is not true everywhere. Yeah. And I love that the questions are coming from people who already know me. This is going great for me.
Well, Tiffany, I'm really thrilled you're here. This is a most unusual experience because you are one of many hundreds, perhaps, and I'm standing in front of Ron Gallo, who oversees hundreds or thousands of donor-advised funds and other charitable issues, and this is very special to have someone talk about what they do. So thank you. We don't talk together, the major funders in this community, and this is special. So the question is, the elephant in the room is, how much money do you give away a year, and how is that budgeted within the Humana Corporation?
Yeah, so it's a great question. One of the reasons I took this job is because this is a weird foundation, and that's awesome. So most corporate foundations, sorry, I'm nerdy and I was a lawyer, so tolerate this. Corporations give money to their corporate foundations and they get to do a tax write-off. So what that means is that most corporate foundations are actually funded on an annual basis, right? Like a company looks at it and is like, I got this extra money and I want to write this off, so here's your money. And that actually drives most corporate foundations and what they give, which is why most corporate foundations have a significant variance in what they give year over year. Like a boring, nerdy fact. This foundation is super weird. We actually have an endowment. I will not tell you the number, but I love you all and value you all. And we, that allows us to have stability in our giving. So last year, I think we gave out around $25 million, the bulk of it in Louisville. Under the law, you have to give away 5% of your endowment every year. We do care about that number and we focus on it. And one of the other things it's really special about this foundation in terms of the endowment is the fact that it actually gives me the ability to make multi-year grants, right? Because I told you about how most corporate foundations run year over year. That's why you see a lot of them give one-year grants. We try to give 3 to 5 year grants as much as we possibly can. We do give a few single year, but most of what we do is 3 to 5 years because I have an endowment and I can predict it.
Thank you.
Yeah, thanks for asking that question. I knew the answer to. Henry's my favorite.
Hi,
Second to you, Ron. You're all my favorites. All of you.
I just want to let you know, I sat there for 20 minutes trying to think of an openly hostile question. Quickly, I just wanted to thank you for the thoughtfulness of your approach to philanthropy. You and I came almost around the same time to Louisville, and we both had the same impression of this place and how beyond money, there's an energy that can be put to good. But I do have a question. We are both working in the health equity space, and one of the indicators that always stuns me is the difference in life expectancy on the east side and the west end, 15-year difference.
Yep.
And what would be, your first impressions of what are the factors that play in that? I think implied a lot of it.
Yeah, I think it's a great question. I didn't answer this earlier, but like an interesting difference, it's true everywhere, but this city in particular, like the geographic boundaries are very noticeable and profound. Like the fact that there is a West Louisville, or people talk about a South Louisville, or like the neighborhood discussions does not happen in every city. So you can see a true geographic difference, and you can see it. Look, I live in the Highlands. I can get to a grocery store in no time, and I have my car, and I have all of those things, and it makes it really easy, and my kids walk to school, and blurby blurb. You can live in West Louisville, and we're getting our first hospital in 150 years, right? I think that geographic difference is really significant, and you can see resources have been balanced in one place and not the other. We're seeing some improvements, We're seeing some improvements in the Norton Sports and Learning Center, Goodwill, like the hospital. There are these good improvements, but a lot of work's got to be done to sort of look at how have we maybe not balanced investment in the same way, and how we can right that ship, right? So that's one of the things. The geographic thing, I'll be honest with you dudes, one of the things I really adjusted to in Louisville was like, first time someone was like, where'd you go to high school? I was like, William Henry Harrison High School. And they were like, oh, you're not from here. And I was like, what? No one has asked me where I went to high school in 25, like I had to think about it. It was like really hard. It's still hard. I'm like, where am I going to high school? But I mean, I think that discussion about your identity around your school highlights sort of how we have invested in this community, that we have to break down some of those barriers about like where you went to school and really focus on like, we're all Louisvillians, and like what can we do for everybody in this community. And I have at least now learned in 3 years to say I'm just not from here, instead of being like William Henry Harrison High School. Look at this, I still get people I know. This is going, like, you guys are great.
We're all the Tiffany groupies over here. So our foundation also is in the space of health equity and access to health care. Of course, you're aligned with a health insurance company, but there are a large number of our folks who do not have access to health insurance. And I'm just curious, I think I kind of have two questions, forgive me. If you all are in that space of helping to support services and access to health care for those who are either uninsured or underinsured. And then also, I wonder if you could talk about any work that you all are doing in violence prevention.
Yeah, so let me answer the first question. Again, I'm gonna get super nerdy. So I run a corporate foundation. There are rules about what corporate foundations can and can't do. The baseline rule is the only benefit the company can get from the foundation is brand. So I can't do anything that would be perceived as helping the business make more money, right? Like, so that in some ways hampers some of my work in healthcare, which is why we do a lot of work around the social determinants of health. Because if I do something that's too healthcare-y, I'm violating the rules. So that is part of how we kind of think about the work, is doing the social determinants components versus the insurance side. However, I told you this foundation is weird. One of the reasons I love this job is that if you think about Humana, most of our money comes from serving Medicare patients and Medicaid patients. And so as a business, we are deeply focused on older adults and underserved communities. So like on the business side, we're always thinking about like, how do we make sure people feel good and are healthy in these low-income populations? And so there's a lot of overlap between what we're thinking about and what they're thinking about. And that, I think, is where we've sort of had an intersection. Your second question? Gun violence. We don't have a particular gun violence focus, but what I can say is that we did fund the, sorry Ron, the Safety and Healing Fund. And we have funded a lot of mental health work that's really around addressing people getting help when they need it, people being able to talk about well-being and goodness. It's interesting. A couple months ago, I was talking to the Surgeon General. I just name dropped that. I'm sorry, I really wanted to. I was really excited because I don't get to talk to fancy people like that often. And I was telling him about all our associate stuff, and he was like, you know, service is one of the best ways to combat isolation and depression. And what we can see when we look at all the data around youth and mental health, which is some of what we see in the violence space, is loneliness is a real thing for these kids. And so we really are thinking about it from this mental health service, youth well-being, older adult well-being. There's a lot of social isolation for older adults nobody's talking about, and it is a crisis. And so that's where we've touched our network.
Great questions, Rotarians. I kind of feel your pain. I'm not a native Louisvillian myself. I'm just.
Where did you go to high school?
So I went to Western Hills. And when I first moved to Louisville to be with my husband Kevin, I would be asked that as the first question, and often there was an awkwardness after that. It's like they didn't really know what to do after I said Western Hills and what the next question might be. Thank goodness we ended up having 4 children, so I could then say where they went to school.
I was tempted to make up a school, but then I was like, what's just the wrong one?
I should have done that. I should have been very creative and just, picked a different one every time I talk. But it is funny, and it does show how place-based Louisvillians are and how they think. And I think of Chicago or New York, right? We are a city of neighborhoods, and that's a great thing to have that identity. But we are also all Louisvillians, and so I was very pleased to hear you say that. So thank you so much, Tiffany, for being here with us today. We really appreciate it.
Thanks for having me.
Okay, our next meeting, same place, same time. So here, next Thursday, August 22nd. To register, you need to do so by noon on Monday, August 19th. Or, of course, Deline wants us to consider using the QR code. I think it might make staff's life a little bit easier. And then guests, please do not forget that you want to be over here at the What Is Rotary table as soon as I ring the bell. Our speaker next week will be Deputy Mayor Pat Malloy. Thank you.
I did have one announcement. They are pressure washing out front, so we've been asked to exit through this door or the door right on the other side of this wall, please.